Alright, hi, this is Michelle Walker, and we're going to be doing the second part of the catheterization checkoff. We're going to be doing a indwelling catheter on a female. This is Mrs. Bear, and we have identified her with two identifiers. We've cross-referenced her allergies, making sure she doesn't have any iodine allergies. For this case, she does, so we're going to be using hydrogen peroxide instead to clean the meatus of the urethra. And we've got her in kind of a frog-leg position, and so it's easier to bear down when we're ready to insert the catheterization. For our sterile field, I've made a little trash can to put our trash in as we go along. I've got a 10 cc or 10 ml empty syringe for when we discontinue the indwelling catheter and deflate the balloon. So we're going to drop that on the sterile field once we're all set up here. And I've got tape off to the side for when we're going to put the anchoring the catheter bag onto the leg, the tubing. And the catheter bag is going to go on the bed frame of the resident, making sure it's not on any moving parts of the bed. All right, so setting up our sterile field again. Okay, so with my non-sterile gloves, I'm still gonna just set up here before I put my sterile gloves on. I'm gonna first take out the sterile gloves again, set them off to the side. Gonna take out my sterile field, the drape, so I can put it under her. Shiny side goes down typically. Making sure you don't cross over. You can have her lift her butt up to help. Okay. And then you have and you want to maintain exposure at all times, making sure she is draped over here, and but you got clear exposed visualization of the urethra that you're working with here. This is a fenestrated drape that you can place over the vagina. So we're going to place that there. And you can always tape it down. I typically do, if I ever put a catheter in my working field, I have taped it down so it doesn't move up at the top here. So there's our sterile field there. So you've got you've got everything there. Now we're gonna put our sterile gloves on because everything else is sterile from this point on, until the catheter is in and the balloon is inflated. So I have my sterile gloves on. I'm going to take this extra sterile field and move it over here out of the way. Okay. And I don't want to stop the whole video, but I forgot to take the non-sterile, or the syringe here, so pretend I had done that before. I guess I can do that actually. I can do that once I'm gonna discontinue it. So, all right, so we're going to go ahead, and we've got the alcohol swabs here. We've got a label if we needed to, which we're not gonna collect that. We've got our lubricant, we've got our saline. specimen cup, which we don't need. Okay. So what I'm first going to do is I'm going to open up our swabs here so that we can clean. Or you would have forceps for cleaning the meatus. So I'm going to walk you through what it would be like. So you would take your forceps, you would have your solution on your gauze, or you can take a swab, and you would first, on a female, you would clean the labia majora. So you would be going from the outside down to the anus, throw away the swab in your trash can. Take another one, or with your forceps, you would be anchoring with your non-dominant hand. You would be separating the labia, and so you would continue taking a clean swab or gauze and clean the opposite side, throw away. You're going to be basically doing this 5 times. Then you're going to be cleaning the labia minora again, top to bottom, throw away, top to bottom. The last one, the 5th one, is going to be straight down the middle from the clitoris down to the anus. Okay, so that part is done. You have your catheter that is in the lubrication, and you would stick it in there and hold it, or you can place it in the sterile tray there with the lubrication. And once you're ready, you would take it out, again separating, so you have clear visualization of the urethra, and you would tell the patient to bear down. And for the urethra on a female, it is a lot shorter, so you're going to go in about 2 to 3 inches. And then once you do see urine, once you do see urine, then you're in, you want to go 1 to 2 more inches. So we're going to have her bear down and go in, and then you want to anchor it so it doesn't come out. And you want to take your saline solution, okay, to inflate, and that would be screwed on beforehand so you have a free hand. But basically I'm not going to use it here just so that it doesn't go everywhere, but it would be screwed on, and you would push all the 10 mLs of saline in there so that the balloon inflates. This would be staying on there, and then you're free. Once it's inflated, you're free to let go because it's going to stay put. Okay, and then you would take your tubing, and you can either Velcro it on with the strap that they have nowadays, or you can use tape. I have tape, so I would go ahead and tape it onto the side of their inner thigh, and then the bag is going to be going off the side, making sure it's below the body so it drains. And there's a clip, so you want to put it on, like I said before, on the side of the bed, on the frame, not any moving parts like the rail, so that it doesn't move. So clip that onto the bed frame, and that is it for the sterile procedure. And then you just clean up your field. Now for removing the indwelling catheter, you want to drain your bag first. So say I have a new set of just gloves on here. I have my supplies set up again. You want to drain this, and that's not the sterile part. You can just have regular gloves on. Drain your bag, and you can set that once it's drained. You want to unvelcro or untape your tubing. Okay. And you want to take your, I'm going to pretend that's still in there. you want to take your empty syringe, 10 mLs, and you want to screw that on, and you want to pull back, and you want to deflate the balloon with the whole 10 mLs, and that will be recorded on the chart of when the catheter was placed, how many cc's went in, so you know how many to come out. So once I have aspirated 10 milliliters, then I can go ahead and ask the patient to bear down again, and with swift motion pull out the catheter. And again, for the catheter, when you pull it out, you can wrap it up in your glove and throw everything, including the bag, into your trash can or biohazard or whatever the facility policy is for disposing. And then clean up your field, and that is it for indwelling catheter. Thank you.